Good afternoon, everyone. Welcome to talk number 15 of the weekend webinar series. The name of the series is Windows of Opportunities in Science and Engineering. And this is organized by the Indian National Young Academy of Sciences, INYAS, which is a part of the INSA. And it's basically from the Mumbai chapter of INYAS that we are organizing this. Before I start off, this series was started way back in April by two members of INYAS, Dr. Vikram and Dr. Vivek. And this is just a quick shout out to them, not only just to say thank you for starting the series, but also to let you all know that they have recently been elected as members of the National Academy of Sciences of India. So that is some wonderful news. And one of the things that helped them get that membership was these activities that they have started to encourage you students to get into science and engineering a little bit more. So congratulations to you two. And I'll continue with this series now. Just to give you a quick idea about what we are doing here. Sorry, my screen seems to be stuck. Okay, so basically what we do is we do talks every weekend on a list of different topics, basically to give an idea to the students about what kind of opportunities there are in science and engineering in India. And as a part of this, we have covered diverse topics. As you can see over here, we've had speakers from various institutions around the country. And we've been covering things from basic sciences right up to biomedical engineering to space sciences, etc. In fact, the last talk we had was on economics, which is available online. And that is to say that all the talks so far are available on the INYAS YouTube web page. So if you are interested in any of the topics that I just displayed, you can go and listen to the talks over there. They'll be available even beyond the length of this series, which at present is scheduled to end at the end of July. But if you want to hear some topic, or if you want to know how to get into a certain type of science or engineering, then please let us know. Write in the chat box either here or on YouTube, and we will try and look for a speaker who can help you understand how to get into working in this field that you're interested in. With that, for today's field, what we have is Professor Mansi Thakur, who is from the MGM School of Biomedical Sciences, and she's going to be talking about career opportunities in allied health sector. This is a healthcare sector, sorry. This is pretty interesting because so far we've had people who have been doing hardcore research, but Professor Thakur is not just doing research, but also is teaching a lot and is an excellent communicator, especially for students, and helps them understand how to get into this field. Just a very quick introduction of Professor Mansi Thakur. She's, as I said, at the MGM School of Biomedical Sciences. Her PhD is in medical biotechnology. She is at present the director of the MGM School of Biomedical Sciences and is a professor at the Department of Medical Biotechnology within the school. She has several patents, copyrights, publications, as you can see listed over here, and has contributed to multiple books and has written chapters also. So as you can see, she's extremely prolific, not just in terms of her work, but also in terms of communicating her work. At present, she's the nodal officer in ICMR for the MGM Medical College and has been playing a pretty active role through the entire COVID pandemic that we have been going through. So I'm sure she'll touch a little bit about her experience in that and why the healthcare sector needs to be very strong to get through moments like these. With that, I'll pass the floor or the mic on to Professor Thakur. Professor Thakur, the floor is yours. Please go ahead. I'll stop sharing my screen so you can share yours. I think your mic is muted, so if you can please unmute it. Sorry, your mic is still muted.
Now it is okay?
Yes, now we can hear you loud and clear.
Oh, just a minute.
Sure.
So whether my screens are available?
Yes, we can see your screen and we can hear you clearly. So I'll stop my video, but please feel free to keep yours on so people can see.
So good afternoon, everyone. First of all, I would like to thank Dr. Anup Mahajan And nowadays, because of pandemic, we are only involved through online chatting, WhatsApp, and other things. So I got an interaction with Dr. Mahajan through WhatsApp only, and he has told me that if you are interested, you can go ahead with the topic of career opportunities in healthcare sector. So I am really thankful to Dr. Anup as well as the INEAS organizing committee. And especially, it's my privilege to talk in front of my dear students, because for me, the students are my strength, and I believe that somewhere or other way, as a teacher or as a mentor, we have to take care of their career path, because students are the key role of our future generation, and then they don't know about various sectors of the career where it is there, it is available in our sector. So before going to the my title, I want to share my experience, little bit my experience of for 5 or 6 minutes. Basically, what Dr. Anup has given my introduction, I'm thankful, but I want to share that it is a roller coaster of my life. It is not so much easy that I achieve this much things. I want to share that basically I belong to a very small middle class family, and where I have read or I have born and brought up, it is a very India's remotest area, that is the Chhattisgarh, where the most of you don't know about that state. State you know, but you don't know about the district that is called as the Bastar, which is mainly known for the next light area. Until 2021, after the 70 years of independence also, there was no, it is so much of the remote area, there is no connection of the rail transport. So you can imagine it is very difficult for a person to study there and then came to the Mumbai and they have started their career there. So during that time, when I am in my schooling, I have realized that there were no teachers who were interested to came that particular area. And I got, because I'm a passionate about the studies, and my parents, because the parents are the main role model who are giving about the, who told about your future career, and your teachers. So I have only my parents who have guided me how to go about their career. And as my father is an engineer and he doesn't know about the basic science, what is the basic science here, so he always told me, beta, you only do only the graduation, PG, and then we can see whether we have to go ahead with or not. So my father is always my role model, because he had given me an opportunity. I got an opportunity to go for the undergraduate program in Usmania University, Hyderabad. And later on, after that, he has, because he is a, I am basically a Rajput, and it is very difficult to go for the studies. After graduation, everyone are thinking about the marriage and other things. But my father always give me an insight that if you want, you can go ahead with your education. We are not having any foundation and other things. So because of him, I have done my graduation PG from Raipur, that is the Chhattisgarh, and I'm the gold medalist of the master degree. During that time, why I'm telling about my personal experience, because during that time, after completion of my PG, I got an opportunity to work under a Department of Biotechnology project, where my guide is the anthropologist. So as a PG student, I have done MSc in biotechnology, and just suddenly a sudden change and draft in my career, where I have to join as a guide. She is an anthropologist, and when I am want to join as a PhD, I am having a, so much of confusion in my thought process, whether I am doing right, whether this, I have so much of apprehension, I have a doubt whether my thought process, what I am going to choose in my future for my career, whether it is a right or wrong. So, because as a Indian culture, every student has a focus and they have a streamline that they have to do the particular, if they are taking the 10th, 12th, then they have, if they want, they go to the either art, science, commerce. If they are going for the science, they have to go either for the doctor or engineer. And then if they are not able to get it, so they have to go for the basic science. When they are going for the basic science, they have to go for the MSc and PhD. So during that time, I am also having the same confusion, whether after taking my PhD with the life science department of biotechnology and sudden shift in the anthropology department, then that is the my real turning point of my life, where when I have joined as a PhD in the DBT project, which is a human genome project under the guidance of Dr. Mitashri Mitra. She is my PhD guide, and she is an anthropologist. And because of her, I got an opportunity to meet Dr. Partha P. Majumdar. He is a very well-known, renowned scientist. At present, also, he is a director of Kalyani Institute of Molecular Biology. And when I met that sir, I have a total different perspective about the life sciences. I have realized that until or unless if we are not working as a multi-centric, interdisciplinary, as well as if we are focused with the various skill related work, it is of no use. So when I met Dr. Partha Majumdar, I have he kept him as my idol, as a scientist who has done so much for the society, and how it plays an important role, how he became a well-renowned scientist in front of all the world for the Human Genomic Diversity Project, and he is representing the India at that time. He was representing. So after that completion of my PhD during that time, and because of his guidance and my madam's guidance, I received the Young Scientist Award in my state only. And I have completed very well. I have very well completed my PhD. I got various awards. I have published many papers. Then again, my life came into a roller coaster. I have again a question mark in my life, what I have to do in future. I have done my graduation, I have done my PG, I have done my PhD. Now, what is the future? Now, when I'm telling about my state, that is a Chhattisgarh state, that state only provides, mainly they are providing only the government positions. So I had realized that I have to go for the academic or I have to go for the research. So I have tried my level best. So you all student can imagine, after having a completion of PhD, I am again struggling for my job, and where I have to sustain, how I can sustain. So this led me to come to the Mumbai. So because of my job search, I came to Mumbai in 2007. And when I came to 2007, I came as a very shy personality. I don't know about the Mumbai, because Mumbai, I can imagine it is a very big metro city, and it is very difficult for me to sustain here. But I have only one passion, that whatever I will give, I will achieve, or whatever I will receive, I have to accept in the form of a challenge. And I have to do best in my that particular field where I will get an opportunity. So when I enter into the Mumbai, I have realized that this Mumbai is only a city of industry. It is not a city of like hi-fi research, and we have a very good organization like ICMR organization. We have a TIFR, we have a BRC, but this is known for all the students, those who are at higher level, those who are pursuing, those who are qualifying their net exam, they are qualifying, they are having a good grade scores, those are having an opportunity to enter into these type of organization. So where we belong, how every student who is pursuing their degree, and how they can go inside into the society, and they can serve for the society. So I have joined as a technical person in Thiocare. Most of you know Thiocare at present, because this is the main industry which are giving the COVID diagnostic testing also. So when I have joined, I have done only the routine analysis of testing and blood testing and diagnosis. I within 2 or 3 months I have fed up with those things, because it is a routine thing. There is nothing where I can achieve for anything I can achieve. So I believe in something. I believe in destiny and other thing. So I don't know how it came. The institute where at present I am working is my the dream place. That is the MGM Institute of Health Sciences. It is a deemed university, and this university carry over the many multidisciplinary things. Like we have a medical college, we have a nursing, physiotherapy, engineering, dental. So it is an umbrella, and it is a banner of many programs. So I got an opportunity, and when I have joined this organization, because basically it is a medical college, and when a scientist or basic science person enter into this organization, no one will take you as a positive way. They always think this. If we can see anywhere in the world, wherever we are working, if we are in a scientific community, if we are in a medical community, if we are in an engineering community, everyone have their own entity, and they never ever want the other person can enter into their circle. So it's a struggle time for me also when I am entering this organization, but I take this as a opportunity. My institute is, I have taken my institute as a big platform where I have a many opportunity to serve for them. So when I have joined this MGM, I have completed a at present I am in the year of 14 years I have completed in MGM. So when I have joined in MGM, I have joined as a research officer, not as a teacher, because I am having a very much complex that I am not a good expression in English and other things. I hope many of you and many of our students, those who belong to the rural area, they have that much of impression. They have that sensitivity. We cannot compete with the metropolitan students also. So when I came to the my institute, my management has told me that you can join as a academic faculty, but I bluntly told them it's not my cup of tea, and I am not a good in expression for my students. I am a good in research, so I want to do research only. So they have given me a area research lab where I have to do work for the HIV and TB. So now, why I am sharing all this to my dear students, because you can see I have joined as a BSc Biotechnology, then MSc Biotechnology, then I have done PhD in Anthropology. It is a part of biotechnology, and then I have entered into the medical college where I am doesn't know about the medical of M of this medical, but because I know some techniques which can be useful for our, uh, I know one skill or I know one technique or analytical technique which can be useful for in the medical sector. So I have initiated my work with the HIV and TB, and then my management has transferred me to the engineering college. So it is totally different again, different platform. I have interacted with many of the engineers, and because of that, during when I entered into the engineering college, I have realized that engineers also play an important role, very very important role in the healthcare sector. So I have learned 2 or 3 years in engineering, various different branches like computer science, EXTC, civil, IT, many, many things I have learned. And then again, during that time, I received a 75 lakhs of fund from Board of Research Nuclear Science from BRC. And then at that time, I am only the basic scientist and I am interacting with the engineers. So I have a two pillar where I can be a person where I can give the problems and they can provide the solution. So again, in 2017, they have shifted me to the medical college, and I am now as a director of paramedical institute. So I have realized what is the moral or what is the take home message what I want to share with you all, that as a basic scientist or as a basic person who are doing BSc, MSc, and PhD, we are the main pillar who are coordinating with this triangle, like basic scientists, engineers, and doctors. So why I am telling about these three professions? Because I have realized one thing. Whenever I have entered into the hospital is a cater of the patients. But apart from that, hospital we require the doctor, nurses, physiotherapists, and paramedics. Other way, if the patient as well as doctors or paramedics or healthcare professions are there, it is of no use until or unless if we are not having the engineers, because all the hospitals is stand because of this engineering technology. So doctors will provide the problems, basic scientists will provide the solution along with interacting with the engineers. So when we three are these three triangle, these 3 points will join together, we can provide many things to the society. So I believe in that if the scientists, if we are working on a particular focus area, it is okay. But until or unless if we are not working for the multidisciplinary, interdisciplinary, and we are not integrating with each other, we cannot provide a best thing to the society. So I will come to my topic. What I want to share with you all that the my topic is that the career opportunities in allied healthcare sector. I will bifurcate my this topic in two things. First one is how this career is helpful for the undergraduate student or the 12th student, those students who have just passed 12th. and how they can be enrolled in this profession. What are the various misconceptions about the healthcare sectors? What are the various thought processes why students are not much are involving into the healthcare structure? So I will, my first part of my PowerPoint presentation is to know about what is the health sector, what are the various skill gaps, what are the misconception, what the students are having in their mind, and then what are the various programs which are available, and then every student can also join for these types of program. And later on, I will, in my later part of my slide, I want to share the various opportunities which are available for the students, those who are interested to start up their they can start their entrepreneurship, they can get their funds, they want to do your research. So I can start with that. So why I want to share that what is the health force worker and the basic requirement. So what at present what India faces an acute shortage of the trained health workers. So COVID is the right thing where you all have realized that the key player which came into the society during the COVID pandemic is the healthcare worker. And up till now, we only know about that the healthcare workers are only the doctors and the nurses. But I hope many of the students during their news channels and other things, they have realized that every time there one word came along with the doctors, nurses, and physiotherapists, there is another word came that is called as the paramedics. So I want to give insight what are the various paramedic programs are available for our student so that student get an idea and they can choose their profession as a paramedics. So I have already just mentioned before you that why India faces an acute shortage of train, because there are the large discrepancies in the health force distribution and inequalities in the health worker provisions. So this misdistribution adversely affect the health outcome in India. So what is the estimated based on the census shows that India approximately 20 healthcare workers per 10,000 people. So you all can imagine that if we have a population of 10,000 persons, only 20 healthcare workers are available for our institute, for our Indian population. So what are the various issues and challenges which healthcare workers are facing? So as I have mentioned that mainly, the estimate shows that the 60% of the healthcare workers are live in urban area. Every person wants to come for their job or either any of the things they have to come to the urban area for their livelihood. So similarly, the healthcare workers, a major chunk of the healthcare workers are residing in the urban area, and which accounts our Indian population is about 26%. And we know that our India is India is a country of 70% of population are the rural population. So how we can imagine how much breadth of healthcare workers in our Indian population which are residing in the rural sector. So why healthcare density? We can see healthcare density in urban area is 42 per 10,000, which is nearly 4 times higher than that of the rural areas, which are only 11 workers for the similar size of population when we are in rural. So that the issue of the health force is a barrier to achieve health for all. So there is a high demand of healthcare worker in the rural setting as well as the public health system. So before going that, I want to share that there is a career cluster, and you can see there are the various cluster. I hope many of them, what Dr. Anup has already mentioned you about, you have completed 14 different professions, various areas where you can choose your option. And I am also showing the same thing that if you are, for example, if you are going for this environmental and agriculture system, many of you know that you can go either for the agriculture, food, and natural resources. If you are going for the communication and information system, you very well know you can go for the animation, mediation, communication, information technology. Similarly, with reference to the business and marketing, human resource, and but when we will see to the health science, you can see only one word is written that is called as health science. And because of that, students are not getting awareness or idea what are the various different careers or programs are available for the health science students, and we only know that the health science student is only either the doctor or either the nurses or the physiotherapist. So I want, so before going anywhere, every student, either it may be a 10 student, 12 student, graduation, PG or PhD, everyone, first you all should ask yourself whether what I'm really going to do after 10th or 12th, or can I really be there? Am I sure about my route, whether what I am choosing is the right route? Where and when, where I have to join, and when is the right time where I choose this program? Ask, are my subjects are appropriate? If I don't make it, then do I have any other option? These are the various questions for the student as soon as they are reaching their higher and higher studies. So before going to any, if you are going to take any decision, you have to plan your career. So because what I am telling about you all, that there are the lots and lots of options and opportunities are available. But before choosing any opportunity, as a student, students should listen only to main two are the pillar whom they take as a idol. First one is their parents and second one is their teachers. So I want a teacher should also know the various career professions, because many of the teachers only know about the art, science and commerce, and we know the broad perspective of the areas. So as a teachers, it's our duty to give the correct guidance and career pathway to our students. So as I have already mentioned, there is a lots of options and opportunities are available. But before going to any opportunity and find a new particular goal, you have to know yourself. And how you will know yourself? You have to know, find out what is your interest, what are the values you have inculcated in that, what are the skill asset you are getting, because until or unless if you are not having a skill, no one will give you any opportunity. And know your personality, that is the main important thing. These are the five major things before entering into that any career. Now, uh, I have told you many options, so all options are good and we can compete with each another. But before going to the any option, we have to explore the possibilities. And before exploring the possibility, how you can explore? So you have to do the search. You all at present the student who are in this generation, they are the luckiest student because they got an opportunity of online everything. Everything is available in online. You have to do research, you have to finalize the thing, you have to finalize your choice of interest, and then after that you can make your choice. Now your choice is based on your choices, your career will be defined. Now career, either you may go to the academic or you can based on your talent based. So this choice is a very difficult thing. So because of that you have to do many research, and then only you can make your choice, and then after that you can set your goals, develop plan and address your barriers. And this will happen, this when you will set your goal, it will happen, and then put your plan into your action and achieve your goal. So this is the path of your career. So what I want to share, because my topic is about the healthcare sector. So first, before going to the various platform or various career opportunity, I want to share the few skill gaps which are available in the healthcare sector. So amongst the various career options in medical field, the paramedical happens to be a popular and promising career option. Not only in the developing countries like India, Pakistan, and Afghanistan, both the developed and the developing countries struggling to supply adequate number of trained, qualified healthcare professionals, especially the physicians, medical laboratory professions, nurses, and paramedics. So this is the diagram which I am mentioning. This is the diagram of our Indian scenario. And you can see the 97.7, 97.9% is a gap. You can see this is a distribution of human resource requirement in the hospital, and at present our India is facing a lot of issues where we are devoid of 45 to 55% of nurses, we have a devoid of 15 to 25% of doctors, allied health profession that is 15 to 25, and apart from that the non-clinician that is must for our healthcare sector is 3 to 5%. So you all can imagine how much breadth of these professions is required at the current scenario of Indian profession. Now, what is the current market size of healthcare? Now, till 2014, the healthcare industry presently in the India is $50 billion only. This is the second largest service sector employee in the country. So many of the students, when they are getting this opportunity, they can get 100%, they will get the employment. We can this job profession will provide 4.5 million pupils directly or indirectly, and rating agencies stitch estimate doubling the size sector of 100 billion by 2015. So Indian healthcare, the growth story, a sudden paradigm shift in last 5 years. Now, because of this COVID pandemic in 2020 or 2019, Indian care country is realized that they are very, very behind of other things. We have contributed many GDPs to many other things, but we are not contributing the GDP mainly for the healthcare sector. So this year 2020, India healthcare industry is estimated to about rupees 275 billion, and currently 8% of India's GDP is spent on the healthcare. So this is a Mr. Pradipta K. Mahapatro, Chairman of Executive and Business Coaching Foundation. He has suggested this is not only the important, but it needs more and more amount for healthcare sector for in order to get the best healthcare sector in our India scenario. So apart from 8% of GDP, at present also we require more than 80 billions of US dollar, which can be used for the healthcare sector, so that we can get a best, we can get at least we can get a basic infrastructure facility for the our Indian population. So what I have realized when I am counseling the many of the students, I have realized that many of the students have the misconception in the healthcare profession. And I am happy to share that these are the same points I have come across through when I'm counseling many of the students, those who are preparing for NEET exam. Mainly those students who are healthcare profession, those students only came, those who are interested in the medical field, they want to become a doctor, they want to become a dental or Ayurvedic doctor or homeopathic doctor. So I want to share all the audience that there are more professions than just doctors and nurses. They have a one major misconception that we have to spend whole life in medical college, because many of the students have realized that when they are entering into the medical sector, 5 years of MBBS, 3 years of MD, then they have to do the many specialization. So 10 or 15 years of their life they are spending in their life for the studying only. So that is also the misconception. They don't need to be a smartest kind of kid to be successful in the healthcare. So many of the every student have a thought process that if we are not able to qualify the NEET examination, we are not an important part for the healthcare sector. So it's not necessary that every person should be a 80 or 90%. They are the students who are having a 40 or 60%. They can also be a part of healthcare sector, and they are very well cater the healthcare sector. So fourth point is not all the profession in the healthcare have a contact with the patient. So many of the students have a fear that they cannot work with the patient or the related patient, or we cannot work with the blood and other thing. So I want to give an insight that all healthcare profession does not be in contact with the patient. In my letter slide, I will share how the different profession have different way of catering the healthcare profession. Apart from that, not all the professor have to deal with the gross part of the healthcare. It doesn't have to cost a lot to the college, lot to go to the college. So that is a major misconception. The person, if the student, if he or she qualify the medical profession, he will get a, if he or she will get a government seat, then it is okay. And if we are going for the medical programs for deemed universities and other university, we have to pay 20-30 lakhs. It is the fact that student has to pay that large amount of fees, but this it is not for the all the healthcare profession. It is few professions where we require the fees because we have to sustain our own organization, because it is not run by the government. And second, boy can be a nurses and girls can be a doctor. So these are the various misconceptions during my last 4 or 5 years of experience. I have seen that many of the students have this type of misconceptions. So I want this should be cleared in your mind and thought process. Now, another question will arise: why I have to choose healthcare as a profession? So I want to share one thing. It is my personal experience. Because when I was in school in 10th or 12th, I have a one conception that I want to serve for the society. Uh, Either my education should be useful for the society, and I can be a part of this healthcare sector. So the serving attitude, I am not telling that other profession is not the serving attitude, but this is the profession. Healthcare profession is the profession where you are getting the blessings as well as the monetary benefit at a time. Other professions are not able to get this type of things. You are freely, you are when you are serving for the people, you will get the blessings free of cost, and apart from that you are getting a best salary and best monitoring. So in healthcare sector there is something for everyone. If he is a housekeeping, if he is a nurse, or if he is a paramedical, or if he is a person who is a doctor, everyone have their own values, everyone have their own entity, and uh, everyone have their own self-respect in front of the healthcare sector. Healthcare will always be needed or in demand. Why it is always needed in demand? Because we everyone knows that wherever it is a service or skill based thing, it is always in demand. As I have already mentioned you, like for example the food sector, for example the healthcare sector, engineering field, they are the service providing field, so they will never ever will be in the last stage, so they are always in demand. And second, the opportunities, large number of employability and opportunities are available in the rural and urban settings. Second, there is a current shortage of healthcare workers, especially in the rural setting. Earning potential provide the stability, and at present also the 20 fastest growing profession, healthcare comes in within the 10 range. So we can imagine how important the healthcare profession is there. So all the healthcare occupations, we are organized in five pathway. First one is the therapeutic services. Second one is the diagnostic services, health informatics, support services, and biotechnology research and development. So, what will come under the therapeutic service? I will give you the brief idea so that you can get an idea, and based on that, you can choose your profession. So, therapeutic service, that is the work directly with the patient, provide care, treatment, counseling, and health education information. So, these type of services are the direct contact with the patient, which involves your nurses, certified nurses assistant, licensed practitioners, registered nurse, medical assistant, optometrist, doctors, cardiovascular technologists, and surgical techniques. These point which I am mentioning you, these are the individual programs or courses which after 12th student can join. After 10th also student can join. Either it may be a certificate or diploma, or these are the program which are run as a undergraduate or PG program. Okay. Second one is the diagnostic services. So what is diagnostic services? It creates a picture of client health status at a single point in time. Use the test and evaluation that help in the detection diagnosis. So at present, I know many of the students have known that because of this COVID, many of the student knows the importance of diagnosis. Because whenever we want to know whether we are COVID positive or negative, we want to do for the RT-PCR test or antigen test. That is the important service which play an important role in order to give the picture of your patient. So this involves the various professions like clinical laboratory technicians, exercise psychologists, orthotists and prosthetic, and pathologists, phlebotomists, and radio technicians. So these are the various programs which will come under the diagnostic services. With reference to the health informatics, no, so you all should know that any organization run by the administrator also. So similarly, in the healthcare profession, we also requires a healthcare administrator. So what is the role of healthcare administrator? These are the healthcare agencies which have a data of the patient, information, financial information, computer application related to healthcare process and procedure. So they also play a major role in the healthcare sector. Those are not totally involved with the clinical picture, but they are working as an administrator. So admitting clerk, coder, epidemiologist, community health specialist, ethist, healthcare administrator, health educator, and this transcriptionist. So these are the various professional programs where the student can also enroll and they can enhance their career in these fields also. With reference to support services, so I have already told you before that only the doctors, nurses, and paramedics cannot run the hospital. We always require the support services, and these support services are the biomedical engineers, central service technicians, dietitians, and facility managers, food services, purchasing agent, and transport technicians. So you can imagine a healthcare is also a type of industry. We are always thinking about the TCS, Wipro, and Reliance. They are giving the opportunity. Why we are not thinking of that process? That now Reliance, Symbiosis, and other are also investing their money in the healthcare sector, because healthcare sector is also in his own, it is also a big industry which will cater more than 1,000 and 2,000 employees at a time. So this is a bigger demand in future. In 2020-35, it is a biggest demand for the healthcare sector where we require the large numbers of staffs and students. So these are the top healthcare companies and hospitals which are in chain. And most probably many of you know because I have given for the Indian scenario, that is the Apollo, Sun Healthcare, Nicholas Piramal, Wipro Healthcare, Serum Institute of India, Cipla, Ranbaxy, Fortis. These are the top level hospitals which are having their own healthcare industries. Now, I want to share that we always think that the healthcare is required this time, but at this point of juncture, we have realized that the biotechnology and research and development also plays an important role in the healthcare. Now, how we can say the biotechnology and research? Now, the the use of scientific and technical advancement to the enhance diagnostic and therapeutic abilities in healthcare. So we require the biomedical chemists. So those students who have completed their BSc and MSc in biotechnology, molecular genetics, pharmacist, quality control, and toxicologists, they can be a major part of healthcare sector. Because in recently, like for example, the medical college, when we are running a medical college, we have a medical council of India. Similarly, when we are running a nursing college, we have a nursing council of college of nursing council of India, like AICT for engineering. So in similar way, because there is a great demand in the paramedical, at present in 2021, the government of India has given that Allied Health Council. Now, this Allied Health Council caters 50 major courses or programs which will come under the healthcare sector of paramedics, which also involves. So, I am happy to share that at present we always thought that the biotechnology, molecular biology, and genetics is a plain thing which can be used by the plant, animal, and other thing. But I want to share with you all that Allied Health Council has introduced these type of courses under their program. Because of this COVID pandemic, they have realized a major chunk of this diagnostic part will be catered by the biotechnologies. Because at their graduation level, they have to learn these various say highly sophisticated techniques like PCR, RT-PCR, flow cytometry, microarray analysis, sequencing, which is an important tool for diagnosis and getting the various type of providing the various type of kits and other things. So now at present, these programs are also introduced into the healthcare sector. So what I have mentioned up till now, these are the I have shown you that healthcare sector has a five path, that is a therapeutic service, diagnostic service, health informatics, support services, and biotechnology research. So you can imagine these are the various. If you can see in a therapeutic service, I can show you more than 20 programs are available where the student can choose their career. Similarly, in diagnostic, you can see 15 or 20 because every healthcare sector have their own area. When we are thinking about the diagnostic, we always think about the blood test only. But we never ever thought that the X-ray, CT scan, MRI, pathologist, phlebotomist, all this will come under your diagnostic part also. We know whenever we are going for our any family member checkup, we know that if the person is having a cancer, we know that we have to go for all the blood tests, then we have to go for the PET scanning, we have to go for the CT scan, MRI. Now, this is also a part of diagnostic tool. And every student cannot do these type of activities. So these are the specialized course where the person should be trained for a particular program only. Like if the person is having a laboratory, so he or she should be trained for the laboratory related things. If the person is joining as a radiographer or radiologist, so he or she should understand about the CT scan, ultrasonography, micro PET scanning and other things. So similarly, every field is having their own entity and own importance. So these are the various programs which we are offered at our MGM School of Biomedical Science in Navi Mumbai. So we are running 7 UG programs. We are having 12 PG programs. And the best part is because it is a deemed university, so if the person or student should enter into the college, if he or she are interested in research, they can go at the higher level up to the PG, up to the PhD also. So we are offering this PhD program for various courses also. Now, this program I have shared because for the students who are in the 10th, 12th, as well as those who want to pursue their career in healthcare sector for the undergraduate program. But as we entering into the PG, so everyone when they are entering into the PG, either they are the specialized or they want to do the research. Now, if the student are from the biotechnology and molecular side, they want to do the research. So, as I have mentioned you before, that the biotechnologist or molecular biologist are the key role. Like मैं आपको एक एग्जांपल समझाती हूँ. हमारी जब बिल्डिंग बनती है, तो बिल्डिंग बनाते हैं इंजीनियर्स. अंदर फॉर हॉस्पिटल को ही आप लीजिए, बिल्डिंग बनाता है एक इंजीनियर, हॉस्पिटल को कैटर कराते हैं ऑल द पैरामेडिक्स एंड डॉक्टर्स. बट वहाँ एक इम्पोर्टेंट टूल्स होते हैं, उन बिल्डिंग को बनाने के लिए भी आपको टूल्स लगते हैं. दैट टूल्स आर और द all other courses like biotech, genetics, molecular. Because if we are not doing the research, we are not able to generate the fund, we are not able to generate the leads or molecules. We cannot play an important. They can be useful for the diagnostic. They are providing for the diagnostic kits. They are providing the drugs. So biotechnologists, molecular biologists, and genetics are very, very important in the healthcare sector, as well as they are play an important role in the research. So everyone is having a, when I am interacting with the doctors, I have realized they have many problems. When I am having interacting with the engineers, they are telling that we are not having that much of points where we can give best to the doctors. So main problem I have seen in this scenario of Indian culture scenario, have seen that everyone are working in their own entity. They never ever want to come together and give the solution for the particular thing. So in that phase, interface in between the doctors and engineers, we basic scientists come into a picture. So we have a problem, we have a solution, but now again the major question arises where we have to get the funds. So what are the funding option? First, we have to think who am I in terms of entity. Either I am a student or a researcher or a startup or a MSME. What am I am looking for? Means what I'm looking means in terms of what type of or what amount of or what range of funds we require and where do I stand, whether we are in the early stage of development, whether we are in the proof of concept or whether we are in the technology development. So the students, those who are interested in research, there is a hierarchy of research and education institute. Those students who have a bright student, those who have qualified the NET and GATE with 99 or 98 percentile, they can go directly to the government sectors like the TIFR, ATRAC, BRC, DRDO, because based on their percentile, they got an opportunity and they can serve for the organization. But we have to be not to be demoralized because we have very many research institution in our India. Those students who are interested in this type of activities, so every year CSIR, ICMR lab, DBT lab, ICR, their scientists have their, when they are doing their research, they have always give the projects, and in that project you can join as a GRF, SRF. We have a premier institutions like IIT, NITs and IISER where you can go and do your research. If there also we are not able to complete your research, you are not getting an opportunity to do the PhD, then come to the educational institution where we have a central government university. Those universities are also running the PhD programs. We have state government universities, autonomous colleges, private universities, and affiliated colleges. So similarly, my institution is come under the autonomous private university, that is the deemed university. So we are also providing the PhD programs for the students, those who are not able to qualify the NET and GATE examination, but you have to qualify our in-house examination, which is governed by the UGC rules and regulation, and then you can pursue your research. Now, what are the various key funding sources for technology development? So, in India, there are the major departments, those who are providing the funds, that is the DBT, DST, National Research Development Corporation, Technology Information Forecasting Assessment Council, Ministry of Micro, Small, Medium Enterprises, Council of Scientific and Industrial Research, and Technology Development Board Fund. Why I'm mentioning all this? Because whatever the lectures you have listened in last 14 lectures, they have shared their experience. But I want to share that many of the students don't know about these type of organization also. They don't know about where they can go and they can fetch the fund, they can get the opportunity, and they how they can go for this further research prospect. So at present, the government of India has taken a very good initiative where the students are the key role for our future sector. So the government has taken the initiative that the students are having so much of idea, but we are not able to convert this idea into the commercialization. So what government of India has initiated, MHRD have initiated, they have given they have every institution has to run the institution innovation council. In every MHRD has given an innovation cell, and every institute has to run this institution innovation council. And student get an awareness. We have to call many of the scientists, many of the industrial academia persons, so that they can share their experience and student get motivated and they can start their activities and they can become their good entrepreneur startup incubators, and they will provide such a sustainable activity which can be useful for Make in India. So we have, and for these type of activities, we require the funds. So instead of the government organization which are providing you a fund, there are the various sources of fundings which are available for innovation. You can get the fund when you have an idea. You can take the funds from your family or friends. You can get from the angel investor. You can get from the venture capitalist, government platform, equity finance, grant in aid, and the soft loan. So if you have an idea, you can go ahead with, you can get an opportunity, you can get a fund, and you can start your own business. Now, the getting a fund is not a easy thing. So, what the company or investor wants from you, all of from the student or the researcher or the company man, the person should provide a technical strength of proof of concept. The person should having an investigator credential with multidisciplinary and having a collaborative team. The most important is your multidisciplinary and collaborative team. Third point is the major point is that whether the product or idea which we are proposing will be converted into your commercial potential or the translational capacity. And fourth one is that everywhere we require the scientist or academician as a mentor, because we initiate our work, but we don't know how we have to go about. So at that time, the scientist and academician experience play an important role, and their mentorships play an important role for providing all these insights to you. And then come to the business plan, that is the return of investment. Now these five things will be catered by the various stages of biotech venture, which involves very early stages, development phase, late stage of development, and commercialization. So you can imagine very early stage means any idea which we are having, we have to provide the pre-proof concept studies. Second one is the early stage, that is your proof of concept and risk assessment. The best example I can share with you all, that is your Covishield or Covaxin, which you are at present you are using in the day-to-day life. So similarly, we have many things where we can prove this. So developmental phase means when we have find out that this is a proof of concept, when we have done it, that will not cause any toxicity and assessment, then we have to go for the lab scaling testing, data generation, and technology process optimization. Then the late stage of development involves the validation, which involves the clinical trial and the fleet trial, or product process scaling up. And last one is the commercialization. So every stage, which a very early and developmental stage, every stage, government of India is providing the fund to us. So what are the early stage of development funds? So many of the students, and we at present also in last 2 years only, I have realized that there are many funds are available in the government sector, but we don't know how to utilize those funds. So there is a one agency, that is the scheme that is called as the Biotechnology Ignition Grant Scheme, that which was given by the DBT and BRC. These schemes mainly provides a fund for the proof of concept for the early stage of innovative ideas, and innovative idea means idea is not the part. The idea should be converted or translated into the society, either in the field of biomedical device, nanoscience, computational biology, green technology, any field. If you have a proof of concept and you have a goal that it will be converted into your product and which can be commercialized, so BILAC will provide you a fund. Now, what are the eligibility criteria? If you can see the eligibility criteria, it doesn't require that the person should having a higher degree. There should be Indian companies with the functional R&D laboratories. It may be an incubator. Now every institute are having their own innovation and incubation center. So student can enroll in their innovation incubation center. Researchers can apply, student can apply, academician and scientists can also apply for these type of grants. Now what are the various evaluation process? So it involves, the evaluation process is a team of various scientists, industrialists and the financial persons, which will see whether our product is innovative, whether it is a technology transfer, having a potential impact or capability of commercialization. And if they found that it is a good enough commercialization, then they will disperse a fund of about 50 lakh rupees for a period of 18 months. And the main evaluation criteria, it should be innovative and concept technology. So, because you are my audience are students, so I want to share few achievement of the student. It doesn't matter the person should be having a PhD and other things. So I want to share one of the cutest girl, which is a 12 years old. That is the Kavya Vignesh. She has developed a bee saver bot. That is a robot, and she developed in the year of 2017. And we never ever as a student, we never ever thought that when we are sitting somewhere in some place, we have many innovative things we can do, but we always think very big things. But a small a change or small initiative will play an important role. So you can see this girl of 12 years with her team, what she has realized that when we are collecting the honey, we have seen that we have to burn the honey bee hives, and because of that the lot of bees are killed. So in order we are disturbing our food chain, we are disturbing the honeybee activities. So what she has developed a robot which can relocate the bee hives without harming the bees, and she has given the nickname as a light night queen. And she is the only girl along with her team. In 2017, she represents the India at a robotic competition in Denmark with their unique solution to save the bees, and she received a fund of 15 lakh rupees. Similarly, if you can see another person, that is the Akash Manoj. He is only 18 years old and he received a prize from our president. That is, he had developed a silent heart attack. He developed a novel technique that can non-invasively detect and alert the risk at the patient. So we all know that when the patient is having a heart attack or cardiac problem, we have to give the or we have to do we have to do the non-invasive, we have to do the invasive techniques. So he is the boy who had developed who had developed a monitor which can non-invasively detect the heart rate. So and third, this is a 16-year-old boy, Gurman Singh. He have developed a ice cream, and the I have really admired by this boy because he had given a visually impaired experience of joy of reading. He received a 20 lakh of grant for the device to be produced at the commercial level and distributed across the country. So you can imagine as a small student, if we are giving something to the society, how much blessed he feel. So to that, His device has approximately helped more than 150 people, those who are visually impairment. So this device name is called as ice cream. So I want why I am sharing all these motivational things to in front of you all, because don't think your career is only up to the like you have to qualify the various examination. It's not necessary. You can, if you have your innovative idea, you can do much better than this. It's not necessary everyone should become a doctor, engineer, scientist, or they can reach in the higher position. But as every student, if we have a interest and we can full focus on this type of activities, we can do many things more ahead for that. So similarly, these are the various schemes which are available for you as a student, as a scientist, as a faculty member, where you can give your ideas and commercially you can implement, you can convert your idea into the commercially. So you can see this Prism is a another scheme which are given by the DSIR. They have given for proof of concept they are giving 2 lakhs. 2 lakhs as soon as you have complete your proof of concept, validation testing, they are giving 20 lakhs. And in third phase, they are giving 50 lakhs. So government is now initiating many things for all of you, those who are interested in these type of activities. This is another scheme that is called a Small Business Innovation Research Initiative, which was given by DBT and BRED for the for mainly for the technical strength of proof of concept. Nationals and those things which are useful for the national and social relevance. So the they can give the funds of about 25 lakhs to 100 lakhs of rupees. Now, these are the various schemes which are giving for the early, that is for the proof of concept. As soon as you have developed your proof of concept, you have do, then you have to go for the technology development fund. Now, the technology development fund is that the BIP, that is a DBT BREC scheme. You can see if your innovation has a very high throughput commercialization aspect, the government of India as well as BRAC scheme will provide more than a cap of 25 crores rupees. So it only depend upon this whether the product what we are proposing is useful for the national and social relevance and which can be advanced high risk technology. So similarly, we have a new Millennium India Technology Leadership Initiatives, which was for the eligibility criteria is not for the student, it is mainly for the Indian companies with the DSIR recognitions. So TDP, this is another funding agencies, DST schemes, which is useful for the Indian public private universities, research institution, along with the collaborating Indian companies with DSIR organization. So they are providing a funds for a period of 3 years, and they are evaluating on the basis of your scientific, technological, and financial commercial benefits. So these are the this is the major scheme which is called as the DDPEDST scheme. This scheme is mainly support for the human and veterinary drug development for all the type of medicinal system, including drug design, drug development, and innovative process of knowing generic drug as well as crucial intermediates. So eligibility criteria as a institute, universities, and national level. Why I am mentioning about various schemes, because many of the students you are working as a student in your organization or university or institute, so please go through those type of website, go through the criteria, and if you have any innovative ideas, you can talk to your mentor, you can propose your ideas in front of your mentor, and then you both can apply and you can receive the funds, and you can you can provide something good to the society. So it is mainly this project is for the support for the medicinal research, including setting up the facilities also, support the joint research project of industry academia, grant in aid to the industry of clinical trials for developing drug for neglected disease like tuberculosis, malaria, kala azar, and filariasis. We have these are the banks are also providing the soft loan. Now we can also go for the international collaboration funds. So we have many international programs, that is the Bill Melinda Gates Foundations. They mainly focus on the funds which are dedicated for the agriculture products, malnutrition, because India is a country where we have a 70 to 60% of our children are the malnourished, child health and public hygiene. They are funding up to 1.25 crores up to 5 to 10 crores, and they will give for a period of 18 to 24 months. Similarly, IKP Grant Challenge, their mainly focus area is for the drug, vaccine, and diagnostic device and delivery system. So you can see every scheme have their own priority areas, and we have to focus in which area we want to go and which from where we will get the fund and we can do our research. So they are also, IKP also gave a fund of 62 lakh rupees. Now another one is the Welcome Trust. This is mainly for the transitional medicine and for demonstration of validate the technical for proof of concept. They are the grant challenges from the Canada. So these are mainly supports for the child health development, women, children health and mental health. And mainly this is a we are happy to share that the Canada Grant Challenges has given more than 80 innovation in India. They are highly happy with the Indian organizations or the students, those who are giving innovative ideas to enhance the quality of the development, child development, women and health and mental. Secondly is the Indo-US Science and Technology Forum, which main priority area is to development of the biomedical devices, diagnostic, nutrition products, preventive and curative measure to improve the healthcare and agriculture. So they are able to fund up to 2.5 crores of rupees. Some are the Global Innovation and Technology Alliance. So these are mainly involve the public partnership of the industry as well as the organization collaboration with the Indian companies. So it is a country specific program. If one industry from India and one industry from other country propose jointly to do the R&D for developing a marketable product. This one is the Millennium Alliance, which will fund about 25 lakhs to 3.5 crores, and the mainly funding agencies are Health, Agriculture, King. So I want to share these type of why I am sharing these type of schemes to you. You all have to know an idea that all the world population, all the great scientists or engineers or the doctors or the committee members, they require the major chunk of their grant is going for the healthcare sector. For the service areas like agriculture, we are providing for the food, we are providing for the healthcare sector, and we are providing for the we are providing for the other sectors which are providing the service program. So these are the various fund opportunities where you can play a crucial role if you are having innovative ideas and you can convert into your commercial. So after this, you can also get the market assistance fund. So you have to promote your ideas. You have to do the market search and everything will be provided by Government of India. So these are the various phases. If you have an innovative ideation, you can go for this scheme. If you cover the proof of concept, you can go ahead with these type of BIP, TDP, and DRP schemes. When you have thought that your proof of concept is well established, then you can go for the validation. These are the various schemes. This will provide the fund, and last one is your commercialization. So these are the various phases. It is a very big time period to come a one innovative idea to convert into a product. So now I'm not taking much of time. Now it is my last few slides. So these are the various research activities which are related to our related to our campus with reference to paramedical. So we have a more than 50 plus publications. We have my and my colleague friends. I am not mentioning his name, Dr. Raman Yadav. We have more than 10 patents. One is granted, 22 copyrights. We have one design patent, and we have guided more than 8 students for PhD of biotech, molecular, and genetics. We received the extramural funds. We have authored. So a small institute can also do many research, and this I proudly want to share with you all of that. That what I am mentioning you before, that I have a thought process that I want to serve for the society. So this COVID pandemic has given me an opportunity where I can be a part of my medical sector, where I have realized that biotechnology also play an important role for the healthcare sector, where myself and my team has played an important role for developing a for doing the our in our hospital for the diagnosis of COVID. So we have a COVID dedicated hospital. Our institute is a COVID dedicated hospital of 800 bedded. We are providing all the treatment facilities and everything, and we want that every patient will get every benefit in single room. So my management wants we can start the COVID diagnosis. So I want to happily I want to share that government will get a easily recognition, but as a private medical college, it is very difficult to get a recognition to run this type of diagnostic center. So we are fortunate that the MGM Medical College Central Laboratory was the top amongst the three private medical college who received the approval in Maharashtra to for the diagnosis of COVID-19. And myself, as well as my colleague, my student, Dr. Mr. Yogesh, who is pursuing PhD under me, were felicitated by Ms. Aditi Thackeray, State Guardian Minister, and Dr. Ms. Nidhi Chaudhary, District Collector Raigad, for setting up the RT-PCR laboratory at the district of Maharashtra, Alibag. So this is the major achievement for all of us during this pandemic time. We have not only we are catering for our organization, myself and my staff has guided more than 5 medical colleges who are running these type of diagnostic centers, and we have established a Maharashtra district center of Alibag for the RT-PCR facility. So my I cannot do anything alone. So my biggest strength is my team, and I what I have mentioned you before, team always involve the multidisciplinary look. So if you can see, my management medical director is himself is a doctor, and he during this COVID pandemic he became 2 times. He was in he went to the ventilator, but it is his passion that we have to cater for the society, and he has given an opportunity to serve, given opportunity to all of us that we can be a part of this medical sector. So I'm really thankful for my medical director, Dr. Sudhir Kadam sir. Then Dr. Orekar, he is a MD microbiologist, Dr. Samir, Dr. Khan, my PhD student, Dr. Himanshu Gupta, she is a PhD in genetics, Mr. Yogesh Patel, he is an engineer, Poonam, Surya, and these are my 4 PhD students who plays an important and crucial role during this pandemic time. So it's never ever we can do anything in isolation. The my main motto is I want to share with all of you that without team, without interdisciplinary, and we cannot integrate each and everyone knowledge, we cannot give anything to the society. So our role model of Engine of Health Sciences, Mahatma Gandhi ji, so always he tell the one thing: the best way to find yourself is to lose yourself in service of others. So we believe in MGM Institute of Health Science. We believe to wipe the tears of each and everyone. And I hope I have served my work. And thank you for the organizing committee members.
Thank you so much, Dr. Thakur. That was a fantastic talk. You managed to design it perfectly well to give an idea of what the field is doing, and not just that, but also to listen to your personal journey and the fact that you have a few students who have achieved grand things. It's quite impressive. So thank you for that. There are a few questions. Unfortunately, we are short on time because there's another event happening at 4 o'clock. But let's try and take a few questions if possible. We have one question talking about very specifically. So, what kind of careers should be chosen after an MSc in biotechnology with respect to the healthcare department? That's one of the questions from the participants.
So I have already mentioned you may various factors. If the student is from the biotechnology, if they want to do for the healthcare sector, they have to choose their career for developing a diagnostic kits, developing a biomedical devices, because this is a major thrust area, and various apps, because nowadays everything is the artificial intelligence. So in rural setting, we cannot cater all the doctors to be there in the rural setting. So if the student can develop such a app which can be helpful for the telemedicine things, so this can be useful for the student. And during that time, the biotechnology should be enter into the healthcare sector. Then only he or she will realize what is the basic problem and how he or she can be catered. So these are the major 3 things: diagnostics, the biomedical device, and third one is the telemedicine.
Right. So it's interesting. You just mentioned telemedicine because that's one of the questions we have. Is from your experience, considering you've worked on so many diverse subjects, how has technology really changed the way you're providing healthcare or thinking about healthcare? So, for example, online healthcare, how effective is it, and is it something that can actually take over the physical healthcare, or will not, you'll still have some space for physical healthcare?
Dr. Anup, I want to share with all the students that after 2035, healthcare profession, especially for the doctors, it is a very challenging for the doctors because everything is taken care by the artificial intelligence or the robotics. At present also, India is 20 years behind of the abroad and other thing, but in future, after 20 years, we are also competing with those things. Now, in our, I am giving the example of my hospital only. In my one of the corporate hospital of Vashi MGM, we are doing the surgery with the help of robotics. So until or unless here is the important role, play an important role. We all are thinking about the technology, 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 but we are not thinking about the values which are given by the doctors. The doctor should interact with the patient in such a way that it will give a gesture, a gratitude that the patient will interact with him. Otherwise, in future, nowhere the professional play an important role. Everything will come is a online things. Everything will be the robotics, and everything will be the and everything will be taken care by the robots.
Yeah, it's quite a challenge, that, isn't it?
Yes, it is a very challenging thing, and students should understand that not only the technology plays an important role, you should be changed because this generation, I have seen many of the generation, they only wants to go behind the technology, but they somewhere they lose their grassroots thing that is the value education. So that is very important for the healthcare profession. Otherwise, because healthcare profession not only catering for the patient, they are catering for the other parameters, other relatives, and other things. So it is play an important role for them also. So,
It's a very good point. There's one question on Zoom also. I think Suman Singh has asked, what scope does chemistry stream or students from the chemistry stream have in the medical and healthcare sector?
uh, chemistry students can go for the pharmacological department, like the pharmacology. We have a NLD, we have a various programs for pharmacology, biochemistry related things, and they can go for the diagnostic parts in future. So
Okay, another question which we have over here is, how late can one enter the healthcare sector? So, if a student has done a PhD in, say, physics, is it too late for that student to think
no,
about healthcare?
I never ever think that student is too late if he has done a PhD in physics. He is the right person to enter into the radiology department because, like CT scan, MRI, and radiology and other thing, it all involves the physics and mathematics. So there are the doctors that doesn't know about the all the calculation, permutation, combination, and the physics background person is the right person who can give the idea to the doctors to how to develop a software, how to develop a program so that we can get the best image analysis. And
Yeah.
especially, I want the PhD physics person is the right person because nowadays these imaging software play an important role. So wherever the computer engineers and doctors, there a physician is a required who can give the insight to the doctors as well as the you. So in healthcare sector, I don't think there is age limit bar is there. And according to that, I want to share everyone that according to the National Education Policy 2020, there is a everywhere student can go out in 8th also, 10th also, 12th also, and PhD also. So later on, they can go for any type of studies. There is
Excellent.
no foundation for that.
Yeah, no, that is true. That's one of the best things about the new educational policies. It's a good update. One point which you mentioned a few times during your talk was, there seems to be a case of lots of researchers working in their own bubbles,
Yes.
and there's a lack of multidisciplinary research. Now, as somebody who works in a highly multidisciplinary sector, do you know why that is, and why has India fallen behind in terms of these bubbles talking to each other?
Can you
So why is multidisciplinary research lacking in India as compared to outside?
it is the it I think it is not the right forum where I can share everything to you, but as a scientist, you know better than me because I have worked in the CSIR lab also. I have worked in the normal academic institution also. I think somewhere each and everyone are having a insecurity.
Mhm.
Somewhere I am having a egoism that we know everything, and somewhere we thought that I believe that every scientist should be in such a way that he or she should inculcate their knowledge to the students or juniors. But somewhere we are insecure about our positions, and we think that if the and sorry to say, I think nowadays our students are more capable than us, because they are 24/7. They are available in the online platform, and they know much better than us. And I never ever feel ashamed because my student are the PhD student, and because I am in an administrative position where I can do only the clerical work, but it's my experience which can guide them how to go about. But when they are having ideas, I always motivate those students that they can go ahead with that. And if I am having some collaboration, or if I am having some personal relationship, I can guide my students so that they can get the best idea. So I think somewhere we have to think over that very surely, that and now it is because of that, I think government of India or Modi ji has initiated that startup concept innovation incubation council, particularly in the academic session, where industry academia collaboration, scientific awareness, so that many students get an awareness. Like for example, I don't know about you and your organization,
Yeah.
until or unless if you are not interacting with other scientists and he can recommend my name. So I know there is one organization which is giving this type of platform. So in future I can train my student, you can go for this organization also. But somewhere we have to think over seriously as a profession that those insecurities of no use. And I want to my current generation student also, please, if you are having a good skill, you can achieve anything in your life. You should know only one skill, and this skill will lead you ahead and ahead. No insecurity, no competition should be there, but competition should be the healthy competition, not for the sake of that we have to climb the ladder. We cannot climb the ladder alone until or unless it is a team.
Well
So
said. Very well said. And I'm so glad you mentioned that, because right now the platform is obviously for the younger
yes,
generation to see how science can be done.
yes.
So unfortunately, because we have another session starting at 4 o'clock, we're going to stop this. But there are plenty of students who had questions about how to develop a business plan, etc. So what we will do is we'll share your email address on the sheet that we send out, and if people have any questions, they can contact Dr. Thakur directly for any answer.
Yes, surely, surely. And I hope I have given my justice to my student, and it will at least few students can get an idea and they can become a good entrepreneur. It's my best thing I have given to the student. And thank you,
Great.
Anup, and the organizing committee.
You're more than welcome. And it was a wonderful talk. It was just perfect in terms of how it was put together. So thank you for taking your time off and coming on a series. And we look forward to more interactions in the future
Surely,
with
surely.
Inyas and Nasi, with
For
you and
student,
your
I can do
organizations.
anything. For student, I can do anything.
That's
Students are
wonderful.
my strength. Yes. Thank
That's great.
you.
So one of the things that Dr. Thakur mentioned was being a part of a collective, so you can start sharing things and get talking different subjects. So just to let everybody who's listening know, INIAS, which is the Young Scientists Academy of India, we have a membership call going on right now, which is scheduled to finish in September. It's a really good group of scientists who have come together. This is obviously 40 years or below, but a really good group of scientists who come together and we organize talks and series like these. So if you're interested in joining this group, please search for INYAS, INYAS on Google, and you should be able to get all the information about the call.
So it is a membership only for the 40 years below, or above 40 years can also join?
For India's not, but we have the Indian Academy of Sciences and the the next level up also.
Okay.
So the NASI is there. That's
So I can inform my student also so that they can also join and they can get an idea also for that.
for sure. We'll send you the details also for
Yes.
this.
Thank
Great.
you. Thank
Thank
you.
you so much for taking your time off, and thank you everybody for coming to listen to this wonderful talk. We hope we'll see you next Saturday for another series or another lecture as a part of this series. Thank you so much.